my name is Zarezza. My group member Rachel and I will be talking to you about Hispanic culture as it applies to the healthcare setting.
Hi, I'm Rachel Taylor. I'm going to be talking to you about the specific aspects of the Hispanic culture. So first off, we'll start out with communication. As you would imagine, most Hispanics do communicate with the Spanish language. There are a few different dialects, but Spanish is an overall generalization. And then within the North American continent, a large number of Hispanics also speak English as well. As far as the family roles and organization go, family is highly valued within the Hispanic culture. It is a huge go-to as far as answers, questions, concerns, what have you. So as far as healthcare goes, as you can imagine, with that being their family roles and organization, they do highly seek after medical advice from their family members. The male definitely does play the dominant role within the family setting and makes most of the decisions. The female or the mom does have influence on some of those decisions, but the last say-so comes from the father figure of the family. And also, godparents are really important in the Hispanic culture, and almost every Hispanic child has a set of godparents. As far as biological features go, most Hispanics typically are some kind of brown skin tone. It differs on shading as far as lighter or darker, depending on exactly which country they came from in the South American region. Their physical characteristics, again, also depends on the exact country of origin. They may have those darker or lighter tones, depending on, for example, Mexicans typically tend to be on the darker end of the spectrum versus a Colombian, maybe more fair skin, but yet have the darker hair and darker eyebrows and things like that, dark eyes. And then the overall generalized geographical location of where most Hispanic ethnic background people come from are from South America. That's typically where they originate. Although we do have some who were born here in America. The ethical considerations for the Hispanic culture fall under a few different categories. Death rituals is one, and they usually have a typical Catholic burial because most are of Catholic faith. They do celebrate something called Day of the Dead, which is where they bring the spirits back into anointing, and they acknowledge the spirits' continuation in existence. As far as spirituality goes, the vast majority of Catholic, like I said, are Catholic, and with an increasing presence of Pentecostals, which was an interesting fact. As far as prevention of illness, it is accomplished through prayer. They also, as typical Catholics do, they wear a lot of religious medals, and they keep relics in their homes such as crosses and statues of saints. They often pray with prayer beads and things of that sort. As far as their beliefs centering healthcare, they feel that health is a gift from God, and it shouldn't be taken for granted. Most Hispanics, interestingly enough, will not have a living will or an advance directive. They feel like anything that happens with the health is God's will, which leads me into my next topic, which is ethical dilemmas and considerations.
Cultural specifics relating to health. Some of the common diseases within the Hispanic population include diabetes, hypertension, pernicious anemia, communicable diseases, hepatitis C, childhood obesity, and HIV and AIDS. Top 10 causes of death include malignant neoplasms, heart disease, accidents, homicides, cerebral vascular disease, HIV and diabetes, as previously mentioned, chronic liver disease, cirrhosis, pneumonia and influenza, and then conditions originating in the prenatal period. As far as nutrition goes, a typical diet includes whole grain corn, fruits, vegetables, rice, beans, meat, such as pork and fish, and then herbs and spices. They're finding that the more Americanized the diet is, this places Hispanics at higher risk for chronic diseases. This has a lot to do with access and affordability, so sometimes wage dictates what they're able to include in their diet. Pregnancy and childbearing practices. Hispanic women consider pregnancy a normal condition, and for this reason they may seek care later in their pregnancy and sometimes not until delivery. Majority of Hispanic women endure the pain that comes with childbirth with no relief sought. They also believe that epidurals will cause permanent back problems. In addition to that, they consider pregnancy a hot condition. They may balance that with cold remedies, cold foods, and such. Hispanic women also do not believe in breastfeeding initially. They consider colostrum to be bad milk. They also place coins on the umbilicus to prevent protrusion. And then lastly, many of their babies have these Mongolian spots you'll find on their sacral area. It looks a lot like a bruise. Risk behaviors include macho behavior or stigma that comes with what people may think about the family or the person concerning mental illness or the fact that they need help. They consider alcohol a celebratory thing, so alcohol consumption is a risk behavior. They also only tend to seek care when in crisis. In addition to that, exposures to chemical in their working environment, air and then water pollution may need to be addressed. And then combination therapies. So a sick Hispanic person might simultaneously be using, obviously, prayer, folk or herbal medicine, prescription medication, sometimes obtained from a friend, and then sometimes prescription medications obtained from a healthcare provider. Attitudes towards healthcare practitioners. They respect the authority. They believe that healthcare providers should be warm, friendly, personable, and take an active interest in the patient. So there's a level of, building rapport, exchange of pleasantries and chit-chat before beginning business as far as medical history and physical examination. Nursing implications. Some ways we can provide cultural competent and culturally sensitive care would be allowing same-gender healthcare providers, also respecting traditional medicine, healing, and religious values, and then assessing the beliefs and practices. You could ask questions like, what do you think caused your problem? Do you have an explanation for why it started when it did? What does your sickness do to you? How does it work? How severe is your sickness? How long do you expect it to last? What problems has it caused you? What do you fear about your sickness? And then the most important results that they would hope to receive from treatment. When it comes to communication, you want to evaluate their English comprehension. You can use bilingual or bicultural staff. You can use interpreters or translator phone. You want to use family members and especially children as a last resort, if anything. Comfortable social distance. Interestingly enough, it is half the distance what Americans would prefer. Utilize your active listening, leaning in, eye contact, and then using appropriate titles, especially if the Hispanic patient is older than you are. Encouraging questions, avoiding gestures because they can have other connotations, and then explaining everything as you go along. Things that you'd want to include in health promotion education. You want to approach them from a holistic standpoint. They make these connections between mind, body, and spirit. You want to keep it short and simple. Hispanics are short-term focused. Talk about diet because a lot of their health issues come from diet-related things, diabetes, heart disease, and such. And then more importantly, you want to include the family. We've already talked about the fact that they are family focused. So when they have family in the room, to educate them on diet, to include the whole family, that would affect them as a unit. Death and religion, don't judge. Allow public expression of grief. And then again, including the family. You want to honor their faith and the belief that God is ultimately in control. Regardless of the source of care, Hispanics are likely to include their faith in God as a vital component and understanding of the problem and the cure.
Okay, the last topic is discussing an ethical dilemma centered around basically the advanced directive situation. So because Hispanic people typically do not have advanced directives, this would raise a question as far as an ethical dilemma within the nursing setting. So a person who is in this situation, say they're on life support, they're essentially on their deathbed, they don't have an advanced directive, they don't have any of those things in place, a family member would have to be named as the healthcare power of attorney in a situation like that. And essentially that family member who is named that healthcare power of attorney would have to make the decision to pull the plug or not pull the plug in a scenario such as that sort. It would have to be explained to them. And that's how that ethical dilemma would be dealt with. It would be a tricky situation because, the person or a patient who is in that situation doesn't have anything in place. But again, they feel that it's God's will. So essentially, they would kind of be okay with that family member making that decision because, again, it would fall back into their layout of their family schematics, in which they do rely heavily on family members to make those decisions for them. So in this situation, absolutely, a healthcare power of attorney would be the end result.